All right, good afternoon. Thank you for coming in today. My name is Holly. I will be performing your health assessment. Today we'll be doing a full head to toe on you today. And can you tell me what your name is?
Sean.
Hi, Sean. Nice to meet you. So first off, what I'm going to do here is I'm just going to start with your head. So first I'm looking at your facial skin. We do have notable facial hair and mild acne noted here. If you could just look up forward here, taking a look at your neck, there are no notable masses and the skin is intact with notable facial hair here. What I'm going to do now is just move to palpating your face. So I'm just going to have you look up. Good. And close your eyes. Good. Eyelids are palpable. Nothing, no masses noted. I'm just going to continue to palpate your sinuses here. Any tenderness noted where I'm feeling?
No.
Good. And if you could look down for me, I'm going to take a peek at your scalp and your hair. Hair is all intact. There are no notable alopecia. Hair is clean. And I'm going to continue to palpate the rest of the scalp. No notable masses. Okay? And you can go ahead and relax. Now what I'm going to do is just feel your lymph nodes. Please let me know if you feel any tenderness. Okay. Clavicle lymph nodes are non-palpable. And axillary lymph nodes are non-palpable. Was there any tenderness noted?
No.
Great. What I'm going to do here is I'm just going to check your thyroid. So if you could go ahead and do a swallow for me. Good. Thyroid is palpable, no notable masses. Great, thank you. What I'm going to do next is just test your vision here. I'm going to have you follow my pen here, okay, and test your extraocular eye movements. So convergence is within normal limits. Extraocular eye movements are normal. I'm going to test your peripheral vision here. So tell me when you see my wiggling fingers.
No.
Okay.
No.
Okay. Peripheral vision is intact. I'm going to test your pupil reflexes. If you could go ahead and just look straight ahead. Good. Pupils are round, equal, and reactive to light. Now I'm just going to check your cornea. If you could go ahead and just continue to look straight ahead. Good. Good. We have the red light reaction, and corneas are intact. Also looking at the conjunctiva, there is no redness, there is no drainage noted coming from any of the eyes there. The next what I would do is test vision with the Snellen chart. What I would have you do is stand up 20 feet away from a Snellen chart, covering one eye with this marker here, and have you read the last notable line, and that would then tell me your visual acuity there, whether it's 20/20 or any other different numbers utilizing that Snellen chart. Next, what we're going to do is just, we're going to test some of your hearing, okay? So I'm going to whisper something in your ear, and if you could tell me what that is.
Purple. Green.
Okay, whisper test completed in both ears, able to hear equally. And now what I'm going to do is do the Weber test. What I'm going to do here is place this on top of your forehead. Please tell me if you can hear it equally in one ear or more so, equally in both ears or more in one ear over the other.
Equally.
Equal in both ears. Great. Now what I'm going to do is test for conductive hearing loss. I'm going to put this here behind your ear, just right here, and then I'm going to move it in front. You tell me each time when you can no longer hear it. So the bone on that one was 25, while the air conductive on that one was only 15. So there is notable conductive hearing loss in your right ear there. I'm going to repeat the same thing right here.
No.
Okay.
No.
Great, so the air conduction is greater than the bone conduction in your left ear, so that is normal. Next, I'm just going to take a peek into your ears here. Extraocular is intact. The membranes look great. There is no issues there. I'm just going to take a peek inside your ear. Membrane is pearly gray. There is notable wax buildup. And same thing, extraocular here is intact. And membrane is pearly gray in this area as well. Great. Now that we've tested your ears and your hearing, we're going to move towards your mouth. Okay? So what I'm going to do, can you stick your tongue out for me? All the way out, just relax and stick your tongue out at me. Great. And can you move it from side to side? Yep, one side to the other side. Good. And move it forward and to the top of your mouth. Great. And then stick your tongue out and say ah. Okay, here is also where I would check the gag reflex using a tongue depressor, and I would use a Q-tip to kind of trigger that gag reflex and make sure that that is intact there. Mouth is moist and intact, membranes are pink. What I'm going to do now, if you could just go ahead and open your mouth and close, and do it one more time. And close. Great. No notable TMJ noted with that. Awesome. So that completes the head, ear, eyes, nose, and throat. So what I'm going to do is move towards your cardiac. If you could go ahead and just relax for me. And if you could look away for me. Good. No looking for any jugular vein distension, none noted. And go ahead and look back towards me. Again, looking here, no notable jugular vein distension. And go ahead and just relax. What I'm going to do now is just take a quick listen. And so you can just relax and just go and listen to your heart. Good. While you're nice and relaxed here, just going to take a listen here. Good. So cardiac was normal, S1, S2 audible, no other murmurs, no other S3 or S4 noted. Also listen to the aortic artery, renal arteries, iliac arteries, femoral arteries, carotid, as well as temporal arteries, no thrills, bruits noted throughout. Now I'm just going to go ahead and check your pulses, so you can just continue to be relaxing here. Positive brachial, positive radial. Should go a little forward there. Positive popliteal. just going to check your carotid pulses. And your temporal. All pulses are within normal limits and noted, no bounding. I'm just going to check the capillary refill in your toes here. Good, plus within 3 seconds. Good, within 3 seconds. I'm just going to check here. Good, within 3 seconds. Good, within 3 seconds. So capillary refill is notable and within 3 seconds in bilateral upper and lower extremities. Bilateral upper and lower extremities. No edema noted throughout any of the upper or lower extremities. What I'm going to do now is I'm just going to check your respiratory, so you can just stay there nice and calm, and I'm just going to take a listen. Every time I move my stethoscope, if you could take a nice deep breath. Lung sounds are clear throughout. Also, just going to sit here, I'm going to test for fremitus. So when I move my hands, if you could just say 99.
99. 99. 99. 99.
Great, no fremitus noted. I'm also going to say here, I'm just going to check for percussion. Dullness noted in the bases, but most likely due to the liver here. I'm going to go ahead and have you sit up for me. And I'm just going to check your chest expansion. So if you go ahead and take a nice deep breath. Good. And go ahead and take a nice deep breath again for me. Good. Chest expansion, equal anterior as well as posterior. And now I'm just going to go ahead and take a listen to your back lungs here. And just go ahead and take a nice deep breath every time I move my stethoscope. Last one. Good. Feeling lightheaded or dizzy or anything? Good. Okay, I'm just going to then percuss your back here. Okay, tympanic throughout, no dullness noted. Finally right down here. What I would then do is I would check pulse ox using an oximeter. I would put it onto his finger here to check the oxygenation level of his blood, ensuring that it is above 92%. I would also then check incentive spirometry. With that, I would have him put the mouthpiece in his mouth and then suck in like a straw, testing his lung volume, seeing how much, making sure that he can get to above 1,500 or 2,000 with his lung volume there. Okay, so that concludes the respiratory part of it there. What I'm going to do now is take a look at your abdomen, so I'm going to have you go ahead and lean back for me again. So here I would also move the Johnny upwards to check his abdomen here, looking for any protrusions, looking for any hernias or any notable masses, and then I would listen. Vowel sounds equal, present and active in all 4 quadrants. They are normal active. What I'm going to do there is just do some percussion. I'm just going to have you relax your arms down by your side, please. Thank you. Good. Dullness noted increasingly, but tympanic throughout here. And just palpate, percuss your liver here, the span of your liver. Okay, liver span is about 7 centimeters here within normal limits. And you also can note the dullness of the spleen over here. To palpate for the liver, I would use the hook technique, doing deep palpation in this area right here and hooking from behind to palpate the liver edges and looking for any nodules or any enlargement of the liver. I would also repeat that on the other side for the spleen as well. I'm also just going to do some light palpation here. Please tell me if you feel any tenderness. Any tenderness? Nope. And then I would also do deep palpation, doing one hand over the other, deeply pressing in and watching for any rebound tenderness there. Okay? I'm going to have you go ahead and sit up here for me. I'm just going to check for CVA tenderness. Please let me know if you have any pain with this. Any pain?
No. No.
Good. Okay, so CVA tenderness is negative. Alright, so GI is complete. So from there, we're just going to test your various muscles throughout your body here, and I'm going to be testing the range of motion of your joints. So first, what I'm going to do is just inspect your joints from head to toe. Please let me know if you feel any tenderness. Hip, knee, ankle, and your toes. And any tenderness in any of your joints. Okay? So now I'm going to instruct you to follow a couple of motions here for me so that we can test your range of motion and your strength. Can you bring your chin to your chest? Good. And then look forward. And then look up towards the ceiling. And then back. And then can you look to your left? And then look to your right. And then can you look forward again? Bring your ear to your shoulder. And then your ear to your other shoulder. Good. And then look forward. Can you press forward on my hand? And then back. And then here. And then here. Good. Range of motion within the neck is within normal limits. Neck strength is +5. Next, I'm going to test your shoulders. Can you put your hands straight out in front and then all the way back? Good. Extension and flexion is normal. I'm going to have you bring one arm out to the side, abduction, and add it to your body for abduction. Good. So adduction and abduction. Good. I'm going to have you repeat that motion on your other arm. So and then add it to your body, adduction, abduction, and relax. So range of motion is within normal limits with the shoulders. I'm going to have you go ahead and press up on my hands with the shoulder shrug, and that is +5. Then I'm going to have you relax your arms. And can you curl one arm and relax? And then curl your other arm. Good, and relax. Range of motion within the elbows is within normal limits. Can you press up on my arm? And then push down. Good. And then repeat the same thing over here. Press up. And then press down. Arm strength is +5. I'm then going to test your wrists. So hands out in front. And can you point your fingers down towards the ground and relax. And then up towards the ceiling. And then relax. And then inwards, which is adduction, regular. And outwards, abduction, and relax. And then can you push down on my hands. And then pull up on my hands. And then grasp my fingers. Great, and relax. Range of motion with the wrists is within normal limits. Strength within the fingers and the wrists is +5. Go ahead and relax. Thank you. Next, I'm just going to test your spine, so if you do go ahead and stand up for me. And if you can just touch your toes, and then push up on my hand here as you come up. Good. And then come all the way up. And then lean back as far as you can. Good. And relax. And then if you could laterally bend towards me. Good, and relax. And then go ahead and laterally bend towards me again here. Good, and relax. And can you rotate towards me? Good, and relax. And rotate towards me again here. Good, thank you. Range of motion with the spine is within normal limits. Flexion and extension is normal, and we have +5 strength with the spine. And can you go ahead and do a squat for me? And then come back up. We have flexion and extension with the knees within normal limits. Go ahead and have a seat. Thank you. And continuing with the knees there. Can you press up against my hands? Good. Knee strength is +5. I'm going to have you go ahead and just lay back for me. We're going to touch your hips. Can you bring your knee to your chest? Good. Right here. And can you press up against my hand? Great. And I'm going to then out to the side, and then relax, and then in, adduction, and out to the side is abduction. Go ahead and relax. Range of motion within the hips is normal, +5 strength. And then I'm going to have you bring your knee to your chest again. Good. Press up on my hand. Good. And then I'm going to do out to the side, and then in, adduction, and then opposite is abduction. You can go ahead and sit up. Thank you. So hips is +5, range of motion there. What we're going to then do is your feet. So if you can point your toes down towards the ground, good, and relax. Then bring your toes up towards the ceiling, good, and relax. Ankle-wise, can you point your ankles inwards, good, and relax, and out to the side, good, and relax. Can you push down on my hands, good, and can you pull up on my hands? Great. Can you curl your toes on my fingers? Awesome, thank you. Wiggle your toes for me, and then crunch your toes. Awesome, thank you, good. So ankle range of motions within normal limits, strength in the ankles as well as the feet is +5. And that concludes the musculoskeletal. So then what we're going to do is move towards our sensory, okay? So first here what I'm going to do is be checking your cranial nerves here in your face. So if you could be looking towards me. And can you close your eyes tightly? Good. And relax. Can you smile? And clench your teeth? Good. And relax. Can you raise your eyebrows? Good. And stick your tongue out at me. And say ah. Ah. Great. Awesome. Facial cranial nerves are intact. What I'm going to do now is do the sensory loss. And what I'm going to do, can you tell me whether or not you feel this is sharp or dull?
Should I close my eyes?
Yes, please, close your eyes.
Dull. Sharp. Dull. Sharp. Dull. Sharp.
Great, thank you. Next, what we're going to do is just test some motor. First, what I'm going to have you do is if you could put your hands out to the side, you can open your eyes. Hands out to the side, and I'm going to have you just touch your nose. Good, and relax. And go ahead and put your hands face up, and then flip them. Good, and then rapidly alternate it. Good, so rapid alternation is great. Supine and pronation with hands is intact. And then what I'm going to have you do is take your right heel and move it down your left shin. Great, and can you do that on the other side for me? Awesome, thank you. I'm going to have you then stand up. We're going to test your gait here, if you can come stand right here. And I'm going to have you walk across the room regularly. Great, gait is steady. And then walking back towards me, can you do heel to toe? Great, thank you. And then when you walk back the other way, can you walk on your toes? Great. And then walking back towards me here, can you walk on your ankles?
My heels.
Your heels. Thank you. Awesome. Thank you so much. You can go ahead and have a seat. So motor is intact. I'm going to continue with the sensory here and continue to test for that sharp and dull sensation. Tell me whether or not, I am going to have you close your eyes and tell me whether or not you feel sharp or dull.
Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Keep those eyes closed. We're going to do your legs.
Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp.
I'm just going to test your bottom of your feet.
Jesus Christ. Fuck.
Testing the bottom of your feet. Please tell me if it is sharp or dull.
Dull. Sharp. Dull. Sharp.
Very ticklish.
Jesus.
I'm then going to test your position sense. If you could just continue to keep your eyes closed. Please tell me if I'm pointing your finger up or down.
Down. Up. Down. Up.
Same with your toes. Please tell me if I'm doing down or up.
Down. Up. Down. Up.
Great. I'm then just going to do 2-point discrimination. So if you can just tell me whether or not you are feeling 1 or 2 points.
1. 1. 2. 1. 2.
Okay, I'm going to do that same thing with your feet here.
One. 1. 2. 1. 2.
Great. Able to distinguish between 1 and 2 points. Okay. The other thing that I would check too, so sensory is able to discriminate. One last thing I wanted to check with the corneal reflex, coming back to the facial nerves. What I would do is use a piece of cotton here, and then I would just lightly touch it on the side of his eye, ensuring that we have bilateral blinking, and I'd also do it on the other side there for you as well. Okay? And to continue to test your neural system here, I'm just going to test your reflexes. Alright, so nice and relax here.
Oh, Jesus. It's like my funny bone.
That's your reflex. That'd be +3. Normal. Good. +3 there. I'm going to check your patella. Good. +3. Good. +3. Check your Achilles here. Good. +3. +3. The deep tendon reflexes are all present and within normal limits. So all of the cranial nerves are intact. Next, what we're going to do is just test some of your responses here. Can you tell me your name?
Sean.
And can you tell me where we are today?
Revere.
And can you tell me what time of the year it is?
November.
Great. So patient is alert and oriented ×3. What I'm going to then do is test your serial, able to follow your attention span here. So if you can count down from 100 by 7s.
100, 93, 86, 79, 72, 65, 58, 51, 44, 36, no, 37, 30, 23, 15, 8, 1, 0.
Great, thank you. So able to complete serial completion there. I'm going to just test your memory. Can you tell me what you did last New Year's?
Went to a friend Becca's house.
And what did you have to eat?
Pizza.
Great, thank you. Next I'm going to test your short-term memory. So I'm going to tell you 4 objects, and then I'm going to have you count down from 30, and then I want you to tell me those 4 objects, okay? So car, TV, cat, t-shirt.
30, 29, 28, 27, 26, 25, 24, 23, 22, 21, 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. It's car, TV, cat, and t-shirt.
Great, thank you so much. The short-term memory is intact as well as the long-term memory. I'm just going to have you open up this piece of paper here, and can you follow the instructions on the piece of paper? Great. Awesome, thank you so much. You can go ahead and sit back down. So patient's able to follow instructions, and his psychiatric is intact. So that completes our head-to-toe assessment. Thank you for coming in today, for allowing me to complete this assessment.
You're welcome.
Thank you.